when a patient comes in and they say, "Oh doc, I've got sciatica," it really means nothing to me because that term is bantered about inappropriately. When a person has leg pain, extending past the butt, actually past the knee into the leg, it can be sciatic pain, and we'll talk about what that is, but it can be other things as well, which are easily fixed. And so let me start with the first one. So there's something called sclerotogenous pain, which is the big long term saying if you have a joint in your back that's locked up, there's a pain pattern that emanates from that specific joint down to a specific area in the leg. Now if you have a deep dull ache down the back of the leg, down into the calf, that could be coming merely because you have stiffness in your lumbar spine and you need to stretch it and get it manipulated. That pain can go away nicely with just that gentle treatment. Another thing is you can have what we call true sciatica, which really is defined as this. In your buttock muscles, you have the piriformis that goes from the outside of your sacrum down to your hip. Of interest, that muscle, the piriformis, whose job is to externally rotate your thigh, travels through that muscle belly, the sciatic nerve, which is a compilation of 3 or 4 nerves coming from your lumbar spine that come together in the buttock area and through that muscle. So let's say you have a fall or you've got tightness in the piriformis. You can have nasty sharp pain down your leg, but it's coming from tightness of the piriformis muscle. Maybe you have some underlying sacroiliac restriction on top of it. But just because you have icky, sharp pain down your leg doesn't mean you have a herniated disc. Which leads me then to the third cause. When people do have pain past their knee and it's sharp, yes, in fact, it can be coming from a disc that's swollen, putting direct pressure on the nerve. But again, we've talked about strategies that most of the time you can mitigate that with gentle manipulation and stretching and exercise training. So my point there is, leg pain all by itself is not diagnostic. And we really shouldn't be running to the worst conclusion that you have a herniated disc. You need to explore these other causes as well. I hope that's helpful.